So we have quite a group from around the world at the moment on the call, which suits what we're trying to do. So let's begin, and people can catch up. And remember, the best way to form a committee is when people aren't in the room. So if there's any action to be taken, we can just appoint them to a committee and say, sorry, you weren't around. So let's start then. First of all, welcome all of you to this meeting of the Global Health Connector Partnership. We have a packed agenda, a 1-hour meeting maximum, and we have many people on the call who will talk to a particular topic. They'll introduce themselves as they go along. And if any of you want to contribute, disagree, make a contribution to it, please feel free to put your hand up and we will welcome you to make brief contributions. All right, let's begin. The first thing was our themes. As you remember, we agreed 3 themes in the past, and they were, let me summarize them by calling them disparities, digital skills, and data and digital services. We've allocated people to each of those, and we'll hear short updates from each of those themes, and then with a 4th theme to talk about and agree or disagree today to include it as our next theme. Can I just say this on themes? We all agree, I think it's very important that the Global Health Connector is not simply us meeting, though it's enjoyable, and having a chat every couple of months. It has to produce something real, and in order to have impact. So that's why the themes, I think, are really, really important. And then building on those themes, we are then creating a significant flagship program around the world, which can help us promote those themes again. So there is some sense to what we're trying to do. So let's begin with disparities. I think Anne and is it Andy? It's Andy. You're going to speak to this, Andy. So please introduce yourself and begin.
Hi, for those people who don't know me, I'm Andy Bleeden and I work with the Research Alliance with our communities. We've been tackling the area of, I'll just make this a little bit clearer, the area of disparities or inequalities, depending on which part of the globe you're sat in. The health inequalities thing we've looked at. We've started making progress along with partners from the ATA, with Anne and their colleagues there. We've already had 2 open sessions featuring input from both members of the ATA, colleagues and partners of the ATA, as well as our ecosystems and our members. That's led to, instead of just being a talking shop, that's resources sharing, experience sharing. With colleagues from Third Horizons, working with the ATA, we've helped identify a charter and developed and shared that. This is now going to be co-chaired by the ATA and the ECH Alliance, and our delivery mechanism will be through what we call a thematic innovation ecosystem. So bringing both input from across the pond in the US, but also globally via this thematic ecosystem. What we've already seen from that is a sharing of not just of knowledge, of best practice, but also funding opportunities for where there's potential collaboration between partners such as Teledoc and Babylon, and also partners across in Europe as well, and Africa with our partners as well. And I don't know if you've got anything else to add to that, because I'm conscious I want to nip along and add in other inputs.
Yeah, no, I would just add, Andy, that our group, in terms of getting together, we're very open to taking on more folks. So I don't think that this is so set in stone that we can't accommodate more points of view and more individuals or organizations.
Right.
Yeah. We've had input certainly already from Ishtaf. Amit, if you think there's key people from within Africa, George, again from Australia, welcome to hear about them.
Well, I think that's the theme for all of these themes, isn't it? That it's about taking what people are doing already in their own particular areas and organizations, and just literally making sure we gather that information through these theme programs. So and anyone, any questions? Said Jefferson as well. So any questions on any of that, or are we, I don't see any hands raised. Maybe it's just me not looking for hands. No. So we'll move on, because we will have a few minutes to discuss the overall point of themes and methodologies of themes at the end of the 3 short presentations. We now move on to the digital skills, and this, I think, George Crooks, is going to be presented by Sana.
Yeah, thanks, Brian. So I'm just going to hand over to Sana, who's my
Head of Research and Knowledge Management, who's going to be leading this group on behalf of the collective here. The first meeting's tomorrow, but Sana was going to give just a very brief provocation so that we can kind of set the scene. Sana, over to you.
Yes,
Please.
thank you. Thanks, George. Can you see my screen?
Yes, we can. Yes. Yeah.
Right. So as George said, we haven't got quite as far as Andy's group have done, and unfortunately, that's down to me. I missed a meeting in March due to a family bereavement, and it's taken a little bit of time to get going. But what we've done so far is to agree a meeting date, which is tomorrow. And what I want to do at this first meeting is to kind of establish who we mean by workforce and whose skills we're going to be talking about. So that will help us agree the scope for the collaboration and kind of next steps and objectives for this group. So whose skills are we going to be talking about at the DHI? When we talk about digital transformation of health and care, we divide the workforce that are impacted by this transformation into 3 different categories. And we talk about the frontline health and social care workforce who use digital solutions to support day-to-day delivery of care, and whose digital skills are in question here. And we then have digital health and care sector workforce, who we divide into 2 further categories: technical professionals who design, develop, deliver, and implement digital solutions for use by health and social care services. And a 3rd category, which is fast expanding as a result of digital transformation of health and social care, which is specialist digital knowledge, information, and data workforce, who are then required to deal with the data that results from the digital transformation of health and social care services. And basically, there are kind of 2 main things that our research points to that need addressing in these spaces. And first of all, there's the digital skills gap in health and care sector. And secondly, there's skills shortage in digital health and care sector and categories. And I won't go any further in these, but maybe for tomorrow's meeting, it'd be really useful if the participants who are coming along would have a think about whose skills we're going to be talking about, so that we can agree whether it is all 3 of these, or whether we'll focus on the frontline staff, or if there's another specific area that we'd like to discuss, and whether these kind of categorizations work in all of these different contexts that come together tomorrow.
Brilliant.
Thanks, Sana. And Brian, the last thought I'd kind of like to leave
Yes,
with
please.
everyone that kind of brought me up short is some of the research that Sana has done looking at educating the workforce of tomorrow, is that we are still training the young people of today to deliver health and care in an analog world. And that needs to change, or a lot of our effort is going to be completely wasted. Thanks.
I see lots of heads nodding. So that's why the sort of work you're leading for us, Sana, and thank you for that, because I've seen the other work you've done. That will be really, well, it's crucial to everything, because otherwise you can't have digital transformation if you still got people being trained in analog. I mean, it just does not compute. So if any questions, any hands up? I don't see any hands up. Oh, yes, there is. Rajendra, you've got a hand up there?
Yes,
Please,
yes, Brian.
please,
Thanks, George, for this wonderful, presentation of the roadmap that you're building. So as a part of ISFTH, where I'm the chair of the capacity building working group, so every year we take up, work and share. And I'm glad my colleague, Dr. Jefferson, is here. So last year we did 2 papers, I guess, on this. We created a list of resources that we need, and we did a webinar with the World Health Organization. So this year again we are going deep into the global skills gap with WHO, to do that, and that's already work in progress. Happy to see if we can align rather than creating something beyond that, because I think this is something that it's a part of my deliverable, and I think it's very important for us to address this big need gap. So with WHO, we are actually we are doing 3 projects with WHO. 2 are complete now. We actually did with them defining the standardizing the terminology of digital health. There was a lot of confusion going around, and WHO proposed if my team could help, so we have done that. Second is scoping out for digital health. So WHO is scoping out worldwide, what the country should do. That project is also complete. Third is we are doing the skills gap assessment. that's in continuation with our past 2 papers that we worked alongside. So maybe George, I'll connect with you, maybe make a note. Maybe we'll see if we should sync up and do it together rather than, trying to do it separately. It doesn't make sense. I think I'm very much aligned to George, your leadership, and hats off to you. We are very lucky, thanks to Brian, to have you at the connector and getting an opportunity to work together.
Good. Well, thank you. In a way, you've made a very important point, which is that work that's already being done or is being done needs to be done anyway in your own particular area, but no point in reinventing the wheel. We should bring them together onto this global umbrella, and therefore we might be able to have some impact. George, you wanted to come in, and then Julian, and then Andy.
Yeah,
please.
We'll definitely pick up offline and take that forward. And I mean, the good news is Sana has got WHO represented on the working group, and they're going to appear tomorrow. So, but we will join the dots.
Brilliant. Julian?
Yeah, just, yeah, you hear me? Yeah.
We hear you. Just tell us who you are.
Okay.
I know I spoke to you this morning, but I've forgotten already. Please,
I'm
go ahead.
Julian. I'm board director of the ECH Alliance and the Digital Health Society, member of this council as well. And actually, I wanted just to mention to George and Sana that I would be candidate as well to join this group because I will move for a new position in a university in India. And under my responsibilities, I will have several training programs, including even the training program for managers of hospitals in India. So we have I don't know if it's in the scope of the workforce you were targeting, because we were talking about health and social care workers, but here we are talking about managers of these kind of healthcare settings. And I think it's interesting as well to take them in account. So happy to join the group if you welcome me, George.
Yeah,
Of course.
Absolutely.
And Sana, I think you've put your contact details in the chat, yes?
yeah, I put my email there to just
I
send
will
me an
write
invite.
you.
So I'll ping you an invite to the meeting.
Brilliant. Okay.
Thank you,
Andy,
Sana.
do you
Just
want to
briefly,
speak?
let's, in terms of not reinventing the wheel, we've also already got an existing thematic ecosystem on skills for health. We've already got resources which have been looking at targeting what the needs are and best practice around carers, citizens, frontline staff, etc., etc. So let's not reinvent the wheel. I'll put the links to those in the chat function below. I know we're speaking later tomorrow, Sana and George, on another topic, but related as well. So we'll add those in. But they've done some assessment frameworks already in Denmark, which are spot on, absolutely spot on. So use those, for goodness sake, if you can.
Well, Sana probably knows about those, I'm sure. But anyway,
Thanks.
and I see that Rajendra just put a link for his reports. And then I just like Jefferson, I'm glad to see you putting your hand up because I was about to come to you anyway. So you're very welcome. And I know you're very involved in this area. So please introduce yourself to the team and say whatever you want to say.
Okay, thank you very much, Brian. Hello to everyone. I'm Jefferson Fernandes. Well, my name is written there. And I'm a neurologist based in São Paulo, Brazil, but I'm also the director of the education program of the International Society for Telemedicine and Health, which is based in Basel, Switzerland. And as such, I think it to be a tremendous opportunity, and I have joined the group of skills that we're going to have the first meeting tomorrow. But it's going to be a tremendous opportunity to join effort between, our groups, the Global Alliance and the International Society for Telemedicine. So I'm looking forward to see how can we work together on that.
Yeah, brilliant. Jefferson, thank you. It's good to see you again. And I always ask Jefferson the same question. Is that a virtual background or is that the usual background? You would make me jealous when I speak to you. Usually, usually a beach behind him or something, just to wind me up.
As today I'm working, I put this virtual office behind me, so I focus on what I'm doing.
Okay, it's really good to see you again. Well, I think listening to that, you can all see where we already have what I call dots in things we each of us do. We should therefore be looking at each of these themes and say, what can I contribute to this dot? It should not impede what you're doing. It should actually accelerate what you're doing and just gives you a global audience as well. So thank you very much indeed. So that was a very helpful, useful discussion. Moving on then to the data end. Bleddyn, you're going to speak to that.
So good morning, good afternoon, good evening to you all. So I'm Bleddyn Rees. I'm the chair of the Digital Health Society and running the third theme around data and digital services to support the recovery of healthcare systems. So in a nutshell, that is the focus that we have made of the Digital Health Society Summit on the 4th and 5th of October. And included in the 2 days will be panels on the use of data and digital services, how data can guide the digital skills and workforce requirements. We're going to pick up some disparities, particularly around women's health and the gender bias in datas. And we're going to look at the importance of evidence in the development of digital health products and services. And then finally, we're going to do some things around vaccination information systems, which is what we're doing in our Roundtable 5, which we're halfway through at this moment in time. So the real focus for us around this theme is, as I said, the Digital Health Society Summit in October. So I think that's enough for now, Brian.
Okay. Any comments from anyone? Because I can see where lots of things should start to converge. Quite a lot of are converging already through the DHS Summit agenda, Bleddyn, I've seen. And I know quite a few people here will be involved in that summit anyway with you. Because I know that you, Julian, were working on this in India. In fact, you're already working on it, on AI and God knows what else. And agenda, you're working on it every day from what I can gather, and Anne's doing much the same. Sure, Ahmed is in Africa as well. So I think you'll find quite a few candidates for that working group, Bleddyn. So I will leave you to convene that and do the same.
Brian, I'll just add on this that tomorrow I have an interview with the Harvard Business Review on data for health. You know, they were doing a study on this. So I think it's gaining prominence. I don't know what their agenda is, but I think they're all looking at data democratization and the future of health using data. So let's see when they will publish it. But tomorrow I have an interview with Harvard Business Review on this one. Let's hope for the best. I'll keep you posted.
Thank you very much. So if there's nothing more on that, I don't see any other hands raised. We will move on to the fourth. Well, the proposal is to create a new theme called what I call green health. I admit that is my term. It is not a term that everybody uses, but to me, it summarizes completely. This arose out of a conversation we had, Heather and I had, with people in the European Commission, an old friend called Ilias Yakovidis, and he is now responsible for a lot of what he calls, it's interesting the terminology, environment and climate. And we talked about, he said, I'm not very happy with the health sector. Why not? Because they produce twice as much pollution as the airline sector does. And he was telling me the European Commission are trying to reduce the number of buildings they have in Brussels from 50 to 30. And his DG, which is 1,000 people in it, is going into a building with only 600 places in it to encourage home working. So he is, I think, Bleddyn, is it true that he has agreed to speak at the DHS Summit?
Yes.
Brilliant. Because this is a theme which is we all are involved in some way or other, or ought to be involved in maybe. So, Anne, you have a client, I think it's called a climate SIG, a special interest group. Is that correct? No, please.
No.
Sorry, you're on mute again.
Yeah,
so
you're on
mute.
Off again. Okay. I just put in the chat a article that's in the New England Journal, or was at the end of December. This is getting increasing amounts of attention. So I would just say that it's another reason why there's some momentum around telehealth, not as strong as we want it to be. And abortion has certainly complicated things here in the US.
Yeah, for sure. Any other comments on this? Because this is a decision the council has to take. Do we take this up as a fourth theme or not? Julian, you've got your hand up, please.
Yeah, well, I would vote yes, yes, and yes. Of course, by this topic, it's been a few years now. I'm interested in this topic and looking at what is happening. As Hans said, it's something attracting more and more attention, and it's normal because we are facing a huge challenge, all of us in all sectors. And recently, the interesting thing is that some serious work has been done on the evaluation or estimation of what is the contribution of healthcare sector or healthcare systems to the CO2 emissions and globally to the climate change. There are some interesting scientific studies around that. Just to give you an example, in France last year, they published, a think tank, famous think tank published a report saying that healthcare system in France is contributing to 8% of CO2 emission globally at the national level. So it's not ridiculous. I mean, it's 8%. It's a large part of the emissions. And they made some recommendation to avoid a part of these emissions. So I really think it's a topic we have to invest in the GHCP. And actually it makes the link as well with the whole concept of the WHO and number of scientists around the world around One Health concept, because when we talk about One Health and when you are in conferences around One Health or working groups around One Health approach, you always speak about the influence of humanity on nature and the fact that these kind of new disease like coronavirus, of course, but others, zoonoses, are directly related about the influence of humans on nature and the proximity between both. So I really believe it's a major topic we have to put inside the Global Health Connected Partnership.
Okay. Bleathen, you've got your hand up.
Just a quick comment that, of course, we're members, both the ECH Alliance and the Digital Health Society are members of All Policies for a Healthy Europe. And one of their 3 working groups is environmental. So we're able to reuse some of that work and vice versa if we adopt this as a theme. So I would support adopting this as a theme.
Okay. Rahender, you've got your hand up.
Yes, so Brian, we just are in the last stage of completing our study on environment, health and economy. Never looked at this aspect, I must confess. But I don't know what will happen to medical tourism if airline and health start fighting. So I'm a little concerned, but I think it's an important aspect. Amit, I'm sure, has a serious mind on that, because medical tourism is, flying people to more affordable and equivalent quality healthcare. And if airline says you're polluting more, so I have to relook at the medical tourism. But happy to
electric bikes, Raj.
Yes. Let's look at this. And Brian, we should talk about this particular speaker of what his views are and look if we can get him to Delhi, because we have a huge healthcare network in India. I think if this is the case, we can't ignore this.
No, I agree. So maybe take another, I don't see any other hands up. Maybe I'm going to do something which Carolina, starting with a K, who works with us in one of our innovation director based in Helsinki. Carol, I know I'm springing this on you, but you've done some internal work to see what we as the Alliance Group are involved in terms of climate / green health. And I haven't seen all of the detail yet. Do you want to just speak about that and speak about that policy group that Bleathen mentioned in the All Policies for Health?
Yes, hello everyone and good afternoon. I'm currently at the working trip in Oslo, so sorry for my background, was trying to find a better solution on Zoom. About the, yes, so 2 things, All Policies for Healthy Europe environmental group, as Bleathen announced, we are member there. I'm a delegate and I participated in a number of their meetings. Currently the group is focused on the indoor air quality. So, and the activities were mainly on consulting some papers and consulting some regulations and writing some papers. But I believe that, of course, thematic framework can be or will be expanded. So it's also something that, you know, is cherry picked as one priority, yes. And then going forward it can change. But actually the good news is also, like, then coming to our projects, is that we will start a project in September on the indoor air quality, and we also have the project on that will start in July on skilling, reskilling and upskilling health force for digital and green skills. So this, I think, can really nicely fit also, like, to both the groups, like to
yes.
be green health and also the skills group. And in the past we had a project on urban health, or also like environmental, urban environment and health. So so there is you know, even if this topic is maybe not our core expertise yet, there is some expertise, and definitely there is interest and capacity to work with it.
Right. Thank you very much indeed, Caro. Anne?
Yeah, Caro, I'm trying to help me understand what indoor air quality means and how that's different from the environment at large.
So yeah, coming from Finland, where the indoor air quality is a very sensitive topic. So those are issues related to humidity, to the fungi, to the general, like the air quality in housing areas, in office areas, and in that sense, so it's one part of environment. So it's not but of course also pollen and then different changes in environment influence the indoor air quality. Okay. And Andy is also saying asthma.
Yeah.
Oh yeah. So yeah. So then thinking about outdoor air quality when we think more about air pollution coming from cars, transport, and so on. But yeah.
Yeah.
Mm-hmm.
And it was interesting listening to this chap from the commission. He was saying that the health sector has no idea of how polluting they are, and he was giving examples of data centers, for example, using huge amounts of energy, obviously, and he has a list of what we in the health sector are doing, which is harmful, and what I'm saying, well, then we need to connect with people who do solutions, because you've got to have a need, but we need to have solution providers. So I think I don't see any hands up, but in terms of time, I think we have covered everything we need to cover in that. So the question is, I think I'm summarizing correctly, is we think this is a topic we should take on. We have to work out how we do it, just as we all do with all the themes. But it seems to me that in order to get it started, maybe the thing to do here is that, Julian, if you would work with myself and with Caro to begin this process of setting up this theme, sure. And that then we can come back to everyone and say, what are you doing about this? Can you help us? Because we need help to do all these things. There's only a small number of us, so we need help all the time. So we're now agreed we're going to have a fourth theme. Moving on, sticking on themes, what's come out of this conversation, in my opinion, is that there's a thing that I keep meaning to say and I keep forgetting to say, so I'm going to say it now in case I forget it again, is terminology. I don't mean just between tomatoes and tomatoes, between the US and Europe or England, but I mean generally. So one of the things every theme should be looking at is terminology. What something is called in the States may be something completely called something different in the UK or in India or in Africa. So I think one of the things that the leaders of each theme should be looking at is, do people understand what I'm talking about? Because we could go down different roads thinking we're all on the same track and we're not. That was one small point. The other one was, I think it's just important to have a small group of us, as you're doing tomorrow, Sana, together to define, as you laid out very clearly in your slides, why are we here? What are we trying to do? It's too big a topic to do absolutely everything. So why do we pick those that we think we already have connections or contacts or dots in? And why do we produce some successes in relatively short order? And I would recommend that approach to each of the themes, because frankly, each of these themes, frankly, you could spend half your life on, and I'm not sure it would ever have really any impact. So that's my diatribe over for the day. I've got that off my chest. So unless anyone disagrees, we will move on then in the interest of time. So move on to the flagship summits. As you all know, we have for a long time now, thought that it was very important to build an infrastructure among our partners and our supporting partners to have opportunities to promote particular events, particular themes at particular events. In the last 2 years, we've talked a lot about this. We've had a number of events. And in fact, many of us enjoyed a very successful and enjoyable event in Boston with you, Anne, recently at the ATA Summit. And it was great to get so many of our council members actually physically together for the first time. And so we now know we're setting up a flagship global program. And so we're going to go through quickly today those that we've talked about before. And I want to bring in different people for, again, a short summary of where we are. But remember, the overall purpose is to support each other, to help each other in the events you're doing anyway, to bring in the global aspect to each of those where we can, and where we can be supported locally by connections and opportunities to speak. So this is nothing short of a very ambitious creation of a global flagship program. And we're trying to do it in non-bureaucratic way, and I think we're getting there. So moving on then, first we start with you, Bleddyn, again. You've touched on the DHS Summit already. Do you want to bring people up to date with any other points of the DHS? Because obviously we want as many people there as possible.
So very quickly, this is the only of the flagship events that is virtual. So it is not a physical event. And last year we had around about 750, 800 registrations. So anything any of you can do to increase attendees. So we're very interested in picking up attendees from around the Global Health Connector Partnership. A couple of things to say. We have a session of the trio of presidencies of the European Union. So in this case, this is the Czech Republic, Sweden, and Spain, each of whom will outline, I hope, what they're doing in digital health and healthcare during their presidencies. The other thing is that we're hoping to have a session from Ukraine. Very difficult to know what that will entail given the state of the war and what will happen between now and October. But the idea is to be focusing on digital health solutions. And then finally, we will have an AI session, which Rachel Dunscombe, or Professor Rachel Dunscombe will run. And I think that's all I want to emphasize at this time. Brian, thanks.
Okay, thank you. Just let me 2 or 3 sentences on Ukraine. We have continued with our Ukraine Health Connector process. It's gone quiet recently, not because we've stopped working on it, but we've gone quiet because there's a lot of organization to be done. And we're very aware of the circumstances in which the people we talk to, the Ministry of Health, are now again under attack with the attacks on Kyiv. We are working at the moment on a private invitation-only session with and this is something will be of interest to you, where the e-health people in the Vadim is his name, in the Ministry of Health, would welcome us organizing a basically round table private event, not a big event, not a public event, for him to explain and his team where they are in their process of e-health. They're actually surprised. There's some of the things they've done which quite surprised me in terms of registers and so on and so forth. But they then are looking for input and help on creating virtual situations of hospitals, clinics, etc. Because now they're talking about 500 hospitals having been either destroyed or damaged by the Russians over the last while. So they want to move almost instantly, if you like, to the future type of virtual care that everyone's talking about. So there will be invitations going out to a number of you to attend, if you wish, and contribute to that sort of private event. As far as DHS is concerned, they have agreed in principle to do a virtual presentation at the DHS Summit in October. They're just trying to work out which minister it is. It may well be Alexei, who some of you met on our first webinar with the Ukrainians. He is the Minister for Integration, for European Integration, which is quite far-seeing of them to have a Minister for European Integration. I think we will keep you up to date on that. There's information on the chat about the Ukraine Health Connector. So we have not given up on Ukraine, and nobody should, in my opinion. So are any questions for Bleddyn? I don't see any hands up. So I'm just going to keep going if I could. The next one, good. See, you've just joined us, Vajira from Sri Lanka. So you're very, very welcome indeed. Thank you for joining us. you've come at the right moment because we're now going to talk about Delhi event. And Rajendra, you're going to just explain the background to that and where we are and what we're going to do in the future. Please, over to you.
Thank you, Brian. And I think we have exchanged emails and I've reached out to some of you. I'm typically not an events person, but unless there is a compelling proposition to host an event which has a purpose. So we are hosting Global Digital Health Summit in Delhi on 28th and 29th of October at Vigyan Bhavan, which is the venue where most of the government events happen. We'll share the link about that as well. What we want to do is here work towards the theme of digital health for all. Because if we really want to make health for all, the precursor for that and the precondition is digital health for all. That's the theme of our event, which will be followed by an outcomes report of the deliberations at the event. And there will be a declaration by the all stakeholders about how do we make the digital health for all a reality, which will be signed by people from the government, from the private sector, from the civil society stakeholders, because this is not something that we can do alone. I mean, just industry wanting to do or government wanting to, it's not a one team's effort. So this event has got good response, and it actually came when we were discussing with the Ministry of Health when we are doing a project for them of scoping for digital health in India. They said, can you get us to talk to leaders globally? I said, can't get them one-on-one, but if you host an event, probably we'll get you a few top leaders to talk one-on-one, get into a room, but also get them share for a broader audience, because government has a big focus on digital health. In fact, they have been very open about it. So we have started rolling out the electronic health record for the entire population, which they want everyone to use. So I said, like good part is we don't have privacy issues like in the other markets. So we hope we'll have a faster adoption. And there's a lot of scope, because I think your first theme of disparities gets addressed in India because we have more than any other part of the world. I think digital health can in many ways bridge the primary care divide. So our sessions are themed around it. And I think Brian, for ECH Alliance, I think maybe should be sending out a mailer, which he got it ready yesterday. So he should reach out to people. We would like you all to participate. Vajira, thanks for confirming. And I know is busy. Brian is joining us. Julian is going to be here in India. So for others also, I extend an invitation to join and share. We would love to have you share what's happening in your part of the world. What's the message for this country, which wants to create digital health for 1.39 billion people, which is as good as many countries across the world. So I think it's a huge opportunity. And I still am hoping we'll be lucky to have you, but I know you are busy, but I am an optimistic person.
Okay, so you have an opportunity now to ask any questions. I think it's fair to say that we have a working group between the Alliance and Rajendra and of course Mevish as well, and that will be augmented shortly by Julian and Bea, of course, who are moving to India. This was not connected at the time, but we're now connecting that, and I think it's very fortunate with many other people are really interested. And Vajira, I just want to say thank you very much for agreeing to go to Delhi as well. You'd be more than welcome, especially to represent the Commonwealth and the 54 countries of the Commonwealth as well. And we've got other candidates to journey to Delhi at the end of October. I'm looking forward to it because I've never been to India. And it's one of the few places in the world I haven't actually been to. So I'm looking forward to that. This is a great opportunity for the Global Health Connector to be seen to be relevant in a part of the world which has got so many people and already has a digital health strategy. And I remember very clearly, Rajendra, your presentation about the vaccination program in India at the Boston event. And I do know many people have commented on it since, and just to see those statistics on the stage, we're not used them as much smaller population countries, particularly in Europe. So that was very impressive. So, right, Jen, you've got nice to see you again. Please jump in. Please.
Hey, everybody. Great to be here. It's just wonderful to re-engage with the group after I know a little bit of a few months absence, but just generally, I wanted to comment on several of the things that were happening with the themes and how well they align with the priorities of the American College of Cardiology and maybe I'll go in reverse order because I was just chatting with Rajendra about joining the India meeting. So quickly, I lead both the innovation operations for our innovation program, which has been around since 2016, focused on the digital transformation of care delivery. So we care a lot about virtual care, AI-driven care, and remote patient monitoring. I also lead global programs that focus on delivering education in geographies where we have a strong relationship already, because the American College of Cardiology is a global organization. And we have deep relationships in India specifically, but also in Southeast and East Asia, in Latin America and the Caribbean, and in the Middle East, focused specifically in Saudi and Egypt primarily, although across the region. And so very interested in participating in the Indian meeting, because we're interested in building direct relationships with tech companies in India so that we could marry that with some of our educational content that we're building around how do we guide clinicians to adopt technology in care in the context of cardiovascular care, but some of that can be extractable probably to other things. So we actually put out a telehealth workbook that's meant to guide cardiovascular clinicians, and how do you incorporate that into your practice if you want to be more digitally forward. We have another one on point of care ultrasound as a tool, and thinking about technologies to drive what we call delivery of care at home. So we have a pipeline of things that we're producing. The other thing I'll quickly say is I've already asked Ann and Andy if we could join the Disparities group, because health equity is a crucial pillar of our new strategic plan, which is under development. But I'm also interested in the digital skills. Sana, I emailed you, and the data piece is also interesting because we do have a global effort. So we have data registries, again, they're focused around cardiovascular care. So it'd be specific to that use case, but we have a light version of our cardiovascular registries that's meant to be ingested by a more global audience. So if the data group is in any way interested in that specific, I realize it's rather nuanced to one subset of care, Bledden, I'm looking at you when I say that, please reach out, because I'd be interested in perhaps putting some people on my team into that group if it seems to make sense. So a lot of comments, but very engaged and interested in the direction this group is headed.
Thanks very much indeed. Right. Right. Any other comments on India before we move on? So we will keep everyone very up to date, and there's a lot of momentum behind that. And thank you, Rajendra, for bringing this opportunity to the Global Health Connector. Thank you. Moving on then to Las Vegas. I don't see Rich on the call, but as far as we all know, health, as Rich always says, remember it's spelled H-L-T-H. So we all remember that. We know it only too well. But we, the ECH Alliance Group, are again working very closely with Rich and his team for the Las Vegas event in November. Again, he's asked me to extend an invitation to all of you, if you can, to attend. We already set up, Bea or Heather could tell me, I think it's Tuesday, I can't remember, I'm giving you a little warning. We have a Global Health Connector session built into the health event in Las Vegas. And if I remember, it's on the Tuesday of that week. Heather, if you can do Tuesday, better than 15. I can. 15th, thanks, Bea, thank you. So it's the 15th of November in Las Vegas. From the ECH Alliance Group already, Bledden and Andy and I will be there. You're all very welcome. I know Anne's going to be there as well. And again, we want to support health. We want to encourage delegations and others to go there. And I see in usual efficient fashion, Bea has already put up on the chat all the information I'm trying to remember. So thank you for that. So again, this is another example of where we are having these sessions around the world. And this is morphing into, I think, a very exciting flagship program. And there are not too many of those around the world. So unless there's any questions on that, we'll move on. No questions, right? On the next one, then we have, looking forward to this one, Amit. This is for you and the conversations you and I and the teams have been having about the Flagship Summit in Africa. Do you want to pick up on that?
Yeah, sure.
Please.
So, you know,
please.
What's happened? There are three things that are happening in these 54 countries in Africa. One is telehealth, electronic medical records, and patient monitoring. And this is both by the public sector and the private sector. So driving structured investments and partnership, the countries are open. Recently, I shared one of the Ministry of Health discussions on setting standards, guidelines, just one country. But if you look at South Africa, you look at Egypt, you look at Kenya, Nigeria, it's top of the mind agenda everywhere. I went to the largest ex-con in Cairo, it was still top of the mind. Academia is talking about it. So I think when Brian and I had a conversation, we talked about what if there was an opportunity for interested institutions and organizations to structure partnerships in Africa. Would half a day, 1 day, few hours make a difference? So we thought maybe we should take an opportunity of an event that brings both public and private sector together. So on 24th November, you can see this event that's taking place. And I've given you a little bit more on the chat box of the website, but Men's Health will take place. And it's a full day event in person and on hybrid. Since we got 1,000 healthcare leaders at the Women's Health in February, we probably will get some similar number this time. It's a full day session and there's a plenary around men's health. And on the margins of this, the thematic sessions, either at lunch or dinner, we thought it would be a good idea for those who can make it to have this as a flagship event. And those who can't make it, it'd be great to log online. But it felt like it was a good opportunity for Africa and engage with all the members of connecting the dots, like Brian calls it. Yeah, so it was great. We had the previous strategic partners here. These are the kind of companies we've been dealing with. And these are friends of Africa. Many of them you probably know or work with, but this is a cross-cutting depiction of the companies that we typically get to participate in ministries of health. So it's generally high level and it's ministers from different places. It's decision makers who come, spend a day or two, usually a day. Though most people don't have more time than that. And so I was telling Brian, might be great for us to put it as a flagship summit. So that's the date, that's the event. Over to you.
Thank you. So I've agreed with Amit that I will go to Nairobi for those dates, and no doubt of meetings both sides of it. But it'll give us a chance, first of all, to meet in person, Amit, because we still have not met in person, though I still feel like we have, if you know what I mean. But I see this as first of all, it's part of our mission to support each of the partners as best we can. So we're doing that. And in turn, Amit's been very kind to help us have speaking slots and various things at that event, and also at the side events, no doubt we'll end up doing as well. So I think it's a great opportunity for us to start promoting the whole. And I think particularly one of the things you said there, Amit, which I think is really important, is that I know you're going to have a chat with Rajendra as well, because there's lots of connection between India and Africa, of course, because you run your India-Africa Summit. And one of the coincidences, one of the dots, just to throw out to all of you, and please bear this in mind, that one of the dots that suddenly was joined just last week by Amit was doing a deal with people called the Manipal Hospital Federation, I think it's called the Hospital Group, who happen to be in India. Guess who's going to be living in Manipal? Bia and Julian, because he's at the university there. Rajendra knows them. So these are dots which already there are dots existing. We just have to identify them and connect them. And from that comes good things. So I'm thrilled that we're going to be in Africa. There'll be more details coming out very soon. We're working with Amit and his team, with Pooja and so on. And we will be producing details of that and how you might participate. So again, these are opportunities for all of us to consider. I know it's difficult to do all of them, but I definitely intend to be there, and I'm really looking forward to it. I have been to Africa before, but not to Nairobi and not in Amit's company. I'm told he's a very good host. Is that true? I hope it's. Don't tell me you're not.
No, you're all welcome, and everyone who is keen to come. Like we have such a calendar of events moving from place to place. We all hopefully can go at many places, but we can pick and choose. We would be more than delighted to invite everybody on this call.
Great. Rajendra, you've got your hand up.
Yeah, I thought, Brian, you missed your friends Angela and Helmut from Manipal.
Oh,
To
sorry,
tell us. They're
apologies.
part
Quite
of it,
right.
yeah. Yeah,
Apologies, that's right. Again, one of the directors of the Digital Health Society, Angela Brandt, and her husband spent a lot of time in India. We're at Manipal University, and they will be in Delhi with us as well. So there are lots of opportunities for us to literally meet, which always helps. It certainly helped that Boston event because I think that cemented a lot of the relationships we already had, virtual, but now they're physical and good. So thank you, Amit, for that. We will be clearly working very closely with you and your team shortly. So moving on to, and I've put Washington on this list because I know you're in the middle of organizing or getting that organized. And we just want to say again that we see that as an opportunity for us to help and support as best we can your efforts, which I believe will be in Washington in December. Yep.
Right, the first week in December. And also before that, September 18 through 24, we're doing our second annual Telehealth Awareness Week. And what we've done with this in the past year is build a network of primarily patient groups that are supporting telehealth, who are trying to really make the case that without it, we're not going to achieve access or equitable distribution,
Yes.
or reach people where they need to be reached. So I'm happy to put that, give that to Heather perhaps, and it can be distributed to the rest of the group.
Absolutely.
Thank you.
Brilliant. Thank you. So that's the events. Did anybody have other comments, or are we okay to move on? Right. Silence means consent in my book. So we will move on to the last bit, which we've only got 5 minutes, but that's what we need. So this was a proposal put to us by you, Rajendra, in Boston when one of our first ever face-to-face council meetings. And you had proposed that we should create this award. And what we'd like to do today is talk about the idea of that. You've seen it in the paperwork we sent you, the idea behind it. And then we need to discuss, as you have suggested, the process, because there's no point in having an award if it's just given out to anyone. We need to have certain criteria. So Jen, did you want to brief the council on that, and then we can come to a conclusion?
Sure, Brian. You want me to share the document or just walk through it, whichever way?
No, I think just walk through it. I mean, I think everyone, I hope, has read the original document.
Fair enough. That's good. So, Brian, given the amount of knowledge, connects, networks that we have had, and I'm really appreciative of this Global Health Connector partnership. I think all of us have gained from it. That's a unanimous thing that people would agree upon. And as world is moving digital, we also need to recognize people who are doing outstanding work. That's the fundamental premise. Once you recognize, there are a couple of things that happen. The guy who, or the organization or the governments whom you recognize, they are motivated to do more. Second, most of the other people get motivated to, see that, should I do more to be in that league to be getting an award? So you effectively create role models. And what happens is, this is one area where, as a global health connector, we should actually recognize either individuals, organizations, or even governments who do outstanding work, in making a case for global digital health adoption, which sets up new benchmarks. So I think there are learnings in it, and more than that, there is inspiration. And I think no better organization, because what I see in this frame is people who come with the highest stature in the industry, with impeccable integrity. You cannot convince them to be giving a award to someone. And that's why the process was that any member of the Global Health Connector can propose, but the council approves by voting, who wins the award or whether we give an award. Maybe there could be years where we don't give an award if we don't find person suitable for that. But the goal was that, whether it's a policy or it's a program or implementation, if someone has done outstanding work, let's go ahead as to recognize it. That will also stay when people promote. As a connector, we get, our brand and visibility. More than that, we make the case for global digital health adoption by learning from people. So that was the whole idea, and it's over to the members.
So anyone, any comments? I mean, I've talked to quite a few of you about this, and I think that the idea seems of general agreement. Then we will have a process, and that process, as you say, the agenda will be anyone can nominate. There's got to be certain criteria which we've established, and indeed it's in the chat now again. And if the people meet that criteria, any nominations will go to a closed meeting of the council itself, and they will make that decision. And we're not in a rush to give lots of awards out, because you cheapen the whole thing. But I think in every continent, at least, we should at least consider whether there is anyone around who might be someone we can nominate for the award. We want to keep it at a certain level. So I'm just giving everybody an opportunity in the last couple of minutes to, if anyone's any comment, I don't see any.
If I may add one or two things on that.
Please.
So this came with an idea that this is an award. It's not given, it's earned by the work you do. And to get that award, you should have enough data in the public domain or through an independent agency to justify that you deserve this,
Yes.
So I think this is to be on. So the whole idea was this, to really make it transparent, for even the council members to figure out why and who.
Yes.
Yeah.
Okay, good. Right. Are there any questions? Do I assume, therefore, we're all in agreement? Okay, good. Thank you. That's another thing done. So under any other business, I'll just say we have a meeting already scheduled for the 27th of September at the same time. Heather and Bio no doubt will remind you all of that. But in the meantime, I want to thank those people who are leading these theme groups and starting to put meat on the bones. And we all should be happy to contribute to everything that's going on, because we are a non-government, someone asked me the other day, describe it, and I said, well, it's non-government, it's non-bureaucratic, and never will be bureaucratic, because if it gets to be bureaucratic, we will fail. So I think we just stick to the way we're doing. We're not doing too badly, as it turns out. So on that basis, and given it's 1 hour, we just want to say thank you to all of you who attended. You'll hear from us shortly, and I'll let George go to bed now, and George McGillis says it's not you, George Crooks, and the rest will just go about our daily work. Thank you all very much indeed. Thank you very much. Thank you.
Thank you very much.
Thank you.
Thank you so much. Bye.
Bye-bye.
Bye, everyone.